Hello everyone, and welcome to Community Connection, your window to the world around you. Monique S. Carter, President and CEO of Carter and Associates, is here with us today on Community Connection, along with Dr. Sheila Makool, President and CEO of Back in Motion Chiropractic. Welcome, ladies. It's such a pleasure to have you both here today.
Thank you for having us.
Thank you so much for having me.
You know, your story is sort of unique, and when you told me a little bit about it, Sheila, I wanted you to come and talk about how you met and just the electricity that you both felt together and how you sort of complemented one another. Now, Dr. Sheila, you're a doctor of chiropractic and you have your own office, so tell us how real estate met chiropractic and how this is sort of meshing together.
Well, it's a great story. Actually, Monique was referred to me by a very dear friend of mine for some neck issues that she was having. And so in meeting her and my evaluation of her and just the communication that we had together, we just developed this just unbelievably strong connection, bond, spiritually, emotionally, physically, in every which way possible. We connected, and it was just like this, I don't know, like an explosion. Of friendship.
Yes.
And
Immediately.
yeah, it's so hard to describe.
Yeah.
I'm going to even let you, elaborate and say your point of view.
Well, first of all, thank you so much for having me, and I'm so grateful for Dr. Sheila. And actually, she has a mutual friend that's in the healthcare business, and he's been sending clients over to Dr. Sheila. And I've known him for a long time, and if he says, listen, go see this person, you just go. It's one of those things. And because of the integrity and credibility of which he operates in. And so I called him and I said, I don't know what's going on with me, but I'm really dealing with some issues with my left arm. And I'm kind of a workaholic, I guess, very committed to my trade, and I have a passion for people. So many times people that are passionate, they put that on the back burner, their personal lives or their who they really are for the care of other people. And so I'm talking to him, and he says, I want you to give Dr. Makool a phone call. And so I thought, oh boy, I'm not gonna even get in. He's really speaking highly of her and saying that, she's passionate and she is very diligent in her practice. So I'm thinking I'm not gonna be able to get in, and I need to see someone right now because I'm hurting, I'm really hurting. And so I tried to numb the pain as much as I could. And I called, and she took my call immediately. She kind of broke away from a client. She took my call. She kind of very quickly said, listen, we need to schedule you. Let's get you in. And then she went back to attending to her client. And I was able to get in the next day, which I was very surprised by. But from the minute I walked in the door, and I'm very sensitive coming from corporate America and customer care. I'm real big about customer care and servant leadership.
Sure.
And I saw it from the minute I walked in the door to the front desk. It started with that, and I'm looking for that too. I'm hurting, and I'm looking for compassion and care, and so the expediency and the care and concern was there at the front desk. And then when I met her, from the minute I met her, I saw passion on this woman that was, I thought, quite amazing. But to have started getting the treatment, and before I was hanging left-sided because I could hardly walk. It hurt so bad. But because of her procedural excellence and her heart for what she does, it overwhelmed me. We took a very close connection immediately. I think it's because she's not only a woman of integrity and passion, but she is a woman of God, and she trusts God, and her faith is in God so strongly that she's not relying only on her own strength. And I saw it, and I fell in love with it. So I've been going back to her, and we've just connected, and I'm so grateful for her. I don't know what to do. And everywhere I go, when someone does me the way that she has, and her staff and team, she doesn't know me, but that's how she is with every client. And I walked into a store just before a restaurant before coming in here, and a woman met me from the minute I walked in the door. She's like, there's something about you, you're glowing, what is this? And I'm thinking, no, I'm hungry. That's what you're hearing. No, I'm just hungry. I want my coffee right now. But I was sharing with her that I was coming on, and I told her, I said, I'm so excited about today because there's a woman that I have met that it's just by divine providence that we connected with one another on so many different levels. But to now be able to go to work and feel better, and I know I got to still keep getting the treatment, but she's dynamic. And I don't say that just because I'm sitting here. That woman heard me talk about her and said, I'm going to meet her. And I gave her the number and the whole 9 yards. So now I've rattled on, but I'm excited. People have got to get to know this woman because she's been at it for 20 years. To see her heart, I watch her. And I'm thinking to myself, oh my goodness, you know, you have a powerful spirit towards helping people as me. And that's why I'm connected to her, because she wants to change lives. So I'm grateful.
Gonna make me
grateful.
cry. That's so
That's so
beautiful.
beautiful.
Thank
Right,
you.
That was beautiful.
That was-
and that's about the
that
human
was
connection.
Yes.
You
beautiful.
know?
Thank
For
you.
sure.
And
sure.
especially when someone's taking care of you physically,
Yes.
you know, and you have that connection with them, and you know that you can trust them and
Yes.
they care about you. It really makes a huge difference.
For sure.
You know, chiropractic, there's a lot of skepticism about chiropractic and how it works.
Yes.
And so when you went in and you thought, okay, I'm going to see a chiropractor for my issues, what were your thoughts? Were you completely, committed to the fact that chiropractic is what you need, or were you a little bit skeptical?
I was skeptical and I was afraid. I was afraid. I've never had the kind of pain that I've had, and I didn't understand it. I had a little bit of pain in my back, but everything was shooting down my arm, and it caused me to go to urgent care because of it. I was doing a conference, and I had to basically fake it throughout the conference, but I was in pain.
That's hard.
I was in excruciating pain, and I was feeling the tingling in my hands, and it was coming down, but I didn't, you know, if I touched my neck, I was fine. But if you rub my back, it hurt a little. But I couldn't connect my neck with, why is my arm hurting so bad? I mean, why is this hurting so bad? And didn't realize that, you know, you've got, you know, whatever those connections there that impact so many things. I didn't know that. So I thought it was something that maybe I slept the wrong way. I thought maybe it would bounce back, I would get over it. And then when I'm hearing, you need to go see a chiropractor, I'm thinking, oh my goodness, that means that they're going to have to push down on bones, and there's going to be some cracking, and you know, I mean, you think about all
They're
these
gonna
things,
break me.
you know, oh my goodness, in half, you know, and you know, I mean, I'm talking to her, and she's sweet and kind and precious on the phone, and
don't
I'm
look too
thinking,
mean.
oh my goodness, you know, I mean, this is a rock star here, but you know, I thought, I don't know what to really expect. All I know is I need help. I need help right now. And when I went through urgent care, you know, they kind of said maybe a pinched nerve, maybe a muscle spasm. Again, I'm
So what was their solution for you in terms of?
they just gave me meds.
Okay.
They gave me meds, and so it worked. And then the pain came back, throbbing.
After the meds.
Yeah, I thought, well, maybe the meds would knock it out, because in past times, you know, if something, I'm normally healthy. But this was a real issue, and in my business, I have to be upbeat, I have to be motivated, I have to be going up and down steps,
smile
I've
on
got
your
it
face.
all day long, you know, and to have this, it was scary, it was frightening, because, you know, people today are stopping their jobs because of injuries.
Absolutely.
And I'm thinking, what am I gonna do? So, yeah, I was concerned. And so the walking in and meeting her, you know, and connecting with her, and just hearing the education. She educated me. She showed me, you know, whatever my results on the X-rays, and explained it to me. But because she took me through step by step, it took the fear away, it took the anxiety away, if that makes sense. And
No, absolutely.
I know that for
Bedside
people,
manner.
when people are going through, you need to see about
Sure.
yourself. And so
Absolutely.
I found someone, and I mean, she's such a distance from where I live and everything, but I know that I'm in the right place. I'm in the right place with her, no question about it. She goes, I'm sorry that I'm such a long drive away. And I'm like, no, you're so dynamic. I don't care how far you are. I'm going to come and see you, because I believe that you're the answer to my prayers as it relates to what's going on with me.
That's wonderful, Monique.
Thank you, honey.
Dr.
Thank you.
Sheila, so she walks into your office and she has this issue. Explain to us what it was. And
Things I see every day in my practice. What we're dealing with is the nervous system and its relationship to the spine. The spine is made up of all the different vertebrae from the neck all the way down to the lower back. And the vertebrae are separated by these discs. And normally these discs are nice and plumpy, just like this. And what it does is it separates the bones and allows for room for the nerve to exit from the spinal cord, and the nerves in the neck are what innervate the arm. So in Monique's situation, I hope you don't mind me saying, but
Sure.
she has a degenerative condition with her neck that has taken her from this stage of a normal condition to now a situation where the disc has actually dried up and dehydrated. She's lost that space in between there. And what it does is, because of the compression that's on there, it causes a bulging disc, or sometimes just because of the narrowing, it'll narrow the opening where the nerve exits from the spinal cord, and there'll be compression on that nerve because of the narrowing. We call that neuroforaminal encroachment. And it's just like the nerve getting choked by the bones coming together because of that lack of separation there. And that's what's happened to her. She has a degenerative condition with her neck now that she needs to have treatment for. Meds are only going to cover it up for a little while and mask the pain. She needs to have treatment. My treatment consisted of traction first and foremost.
Right.
So once we were able to...
Traction.
Yes, once we were able to establish the diagnosis with the x-rays, then I was able to know how I was going to treat this. Because you can get a pinched nerve from a lot of different things. So we have to establish what the cause is first. And that's why the x-rays are so important, because it tells me the whole story.
Right.
So now I can visually see what's going on with you and know how to treat you. Do we just have a bone that's possibly out of alignment, maybe putting pressure on that nerve? What's the situation? Is it muscle? Is it bone? Is it disc? What's going on? So now that we've established the diagnosis, now I know what the course of treatment will be.
Right.
In her case, number one, traction. What we have to do is we have to separate those bones, open them up, relieve the pressure on the nerve. What happens with traction is you get separation, then you get togetherness. Separation, togetherness. And then once she's weight bearing, everything kind of comes back and squeezes down again. So what you have to do is you have to retrain all of those structures to kind of stay in that open position. So every treatment that you get is a building block. One treatment from the next one, from the next one, it's a building block, and it aids in the overall recovery. So at some point, those bones are going to stay somewhat open, relieving that pressure, and your symptoms go away.
Yes.
The second part of that, the traction is the first part. The second part is the actual adjustment. One of the other things that are going on with her neck is she has what's called a military neck, which means that instead of the normal curve, there's this normal C-shaped curve in the neck where the curve comes out towards the jaw. Her neck, unfortunately, is very, very straight, and we call that a military neck. So the second part of her treatment would be the adjustment. And what I do is when she's laying on her back, I come up behind her and I make a gentle adjustment with the bone going forward in the position that it's supposed to be in with that curve, thus relieving even more pressure on the nerve and helping it to stay in that position so that she has, her symptoms are decreased permanently.
But that's over time, though.
That's over time. Unfortunately, she has a progressive disorder. It's osteoarthritis. And once you have arthritis and once you lose that spacing with the disc, you can't get it back. But with chiropractic care, what we're doing is we're putting motion back in those joints, because with arthritis you get calcium deposits that actually lock those bones together, and then you'll see people that they don't have their range of motion. With chiropractic, it's the only treatment that restores that range of motion.
I'm calling for an appointment.
I've been trying to get you for a long time.
I know, I'm coming in.
People are scared and they're skeptical.
Right.
Everyone is. It's a human, emotion. It's a human fear, and but the good thing about me is my experience first and foremost.
Yes.
I've been doing this a very, very, very long time.
Yeah.
And by the grace of God, I've never hurt anybody in my life. I know what I'm doing. I have experience, and I'm very gentle, and I ease my way into it. I don't scare anybody. I don't give, a hardcore treatment where it's going to scare you. I'm very, very gentle initially, just going in, doing what needs to be done. It's a process. Just like physical therapy is a progressive type of treatment, so is chiropractic. So it's a gradual process. She has a condition where there's no cure for arthritis, but chiropractic will help slow down the degenerative process in her. but we're also feeding her from the inside out. Remember, we talked about that before.
We did.
Feeding from the inside out. I've prescribed for her a product called glucosamine, which is a disc building supplement. That's the first thing. Also, we got her some
I
tuna
even heard of
omegas.
glucosamine.
Tuna omegas too help lubricate the joints, help keep the cardiovascular system.
What was the other thing? I'm sorry.
Tuna omega oils, tuna omega 3s. That helps keep everything lubricated.
Is that fish oil?
It's fish oil.
Okay,
Yep.
omega-3.
Yep,
Yeah.
omega 3s. She's already taking a multivitamin. Once she's done with those, we're going to put her on mine, because a lot of the multivitamins over the counter, unfortunately, have a lot of synthetics and artificial things in them. All the products that I sell are 100% biodegradable, meaning they're 100% absorbed by your body. Nothing comes out. It's all good stuff going in. And so supplementation is important. You know, and there's so many different other components that I'm trying to teach her. We're going to get into some stretching exercises and some things that she can get into.
And the massages too.
The massages, we've already hooked her up with one of my team members, and they've developed an amazing bond.
Yes.
Orthopedic products that might be able to help her, special pillows and things like that, that I'm going to get her
those work,
fixed up
the
with.
special pillows?
Absolutely, because what she has is a very straight neck, and it, like I mentioned before, she needs that curve in there. What I prescribe are cervical pillows. They have a curve, so over time, after laying on them, your neck kind of forms the contour of the pillow over time, and even if it doesn't, it's a natural shape and position for your neck to be in, so you'll wake up with less injury. You won't have as much injury when you wake up because your neck is properly supported. So all these things together, proper sleep, water, I can't talk enough about, proper nutrition, you know, all of these things in combination, it's just not my treatment. I'm only one component of her recovery. And those are all of the things that I'm going to teach her and give to her.
And I wanted to say something too, because a lot of people think it's just, you know, due to sport injury, or, you know, they're just big in athletic work, or, you know, maybe even other things concerning certain types of jobs. You know, there's a lot of real estate professionals that have been out there, and they've been out there long term, you know, working a lot of hours. We're on the computer more now than we ever have been, and we don't realize that it begins to impact the body.
Sure.
Texting.
You know, all day, you know.
Videos, video games.
You know, all those things, and that's my situation. Mine wasn't due to a workout or any of that. Mine was just one day I woke up and my left arm was hurting. You know, it was just that fast, that easy. So there's so many people that are probably wondering what's going on, and it might be a misalignment, as she said, or I would have never imagined to sit here and say, I'm actually sitting with a chiropractor because I have to go to one. I'm kind of like, I mean, I'm loving her because she's outstanding, and I need her so that I can be better at what I do, but I never would have ever imagined that I would have this kind of challenge. But I'm glad that I have now a remedy. That's the main thing. And for those that are, you know, maybe going through something, or they're apprehensive, or they're concerned, or they're fearful, you know, I would say that they really need to come in and meet her, because her personality and I think her presentation, it sold me. Because when you are in pain, you need someone pleasant.
Yes. You want a nightingale.
Yeah, you really do.
Florence Nightingale.
You know. Then you look at her, then she has a baby face too. So it was a little bit of that too, you know. But so grateful.
Absolutely. You know, so many people are on computers, and I mean, myself, I'm always on the computer.
Yes.
I mean, most of my work is sitting on the computer.
That's right.
And it literally, I mean, you know, it's the same kind of thing. What is your advice? I mean, how do you, what do you do to maintain your posture, or to, you know, work better, or the height,
that's
or the table?
That's a great question. I mean, in Monique's situation, unfortunately, this has been a progressive thing that's been going on for many, 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 many years. And then all of a sudden, it just got her. One of the first things that I always recommend is, you know, we have conditions that are hereditary too that we can't do anything about. She wanted to know where this came from. I could not give her an answer. I don't know. Because it's a situation whereby it could have happened in her childhood. It could have happened from a car accident maybe that she forgot about, where she had a whiplash injury, and then it progressively got worse. I mean, there's so many reasons and things that can cause something like this. What I always recommend for everyone is, you know, you have to go to the dentist and you have to get regular checkups and you have to check for cavities, right? Sometimes there's little cavities in there that you don't know about, and you don't know about them until they develop into something really big.
That's right.
Teeth are bones. These are bones. And these can
They have
develop
cavities.
And what you have to do is you really have to check them while they're young. So I always try to encourage my patients to bring in their children, because there's things that can develop at a very young age that they don't know about, and then they end up growing up with it, and then all of a sudden when they're older they don't understand why they had it. Well, if they were younger and they came to me, it's probably something that could have been prevented. So first and foremost, I always say, come and get your spine checked. Mm-hmm. The only way to check it is through an x-ray. There are so many patients that I have that come in, they just heard good things about chiropractic, they just want to get their spine checked. I put up their x-rays and I actually show them they have quite a few problems. Nobody wants to see their problems. It's all about fear.
Yeah.
They're afraid.
Yes.
They don't want to see it. Mm-hmm. But knowledge is power. And when you have that knowledge and you have, you know, that tool of being able to go in there and see what's going on, it could be a very simple, easy fix. Yes. And it's better to know while you're young before it develops into something that may not be repairable. Yeah. Just like a cavity, if you let it go, it's going to develop into something bigger. Now you're looking at a root canal, a crown, you know, a pain, you know, all of these problems associated with it, all because you're afraid to go to the dentist. Yes. So if you're afraid to come in for a chiropractic exam, I'm here to tell you, be more afraid if you don't, because that's when something could really develop later on in your life. It could be crippling. It could be something that could really, really take your life away. And you know, if you come in, get it checked out sooner rather than later, you have a much, much better chance of growing up with a healthy spine and nipping it in the bud.
What about MS patients, multiple sclerosis
MS patients have a demyelinization of the spinal cord. It's a progressive disorder that there's no cure for.
Is there a relief, though?
There is relief. There is relief. There's always relief, because what we're dealing with is the central nervous system. Central nervous system is composed of the brain and the spinal cord. That's the main computer of the body. The communication starts in the brain and it sends messages and signals out through the spinal cord. The spinal nerves that exit the spinal cord are the messengers. That's called the peripheral nervous system, because they're outside of the central nervous system. Those are the messengers. Those are the ones that carry the messages to the different parts of our body and tells every single solitary cell of our body what to do. Your body cannot function without these nerves. Any kind of interference with that nervous system, no matter what it is, whether it's MS, I don't care what it is, any kind of interference with that nervous system is going to cause disease and dysfunction of the body. What you want to do is try to keep the spine as healthy as possible and relieve any kind of pressure on the nervous system as much as you possibly can. So if you have MS, you might have other underlying conditions with the bones that may be causing additional pressure on those nerves. You can clear that out and it will help them feel better. Mm-hmm. Anything that you can do that's going to help keep the nervous system healthy, keep the bones healthy, is going to be a relief to any kind of a patient. I don't care what they have. I don't care what disorder it is. We don't claim to cure it. We just claim to help the body to restore itself. It has an innate intelligence. It knows how to do that. That is God-given. Right. And He gave us the grace and the ability to be able to do that for ourselves. That's right. So all we're doing is aiding the body and to be able to do that.
Now, I know you see a lot of sports patients too, with sports injuries and things like that. Football, when they come in, I mean, they really, really, really take a beating on their bodies. Oh yeah.
Yes.
You know,
weightlifters. It's unbelievable. The weightlifters. Yeah. Dealing with any chiropractic patient, we're dealing with musculoskeletal problems, which deal with muscle, bone, and nerve, and ligaments. So it's all connected. Keeping the spine healthy and aligned will help keep the muscles out of spasm, will help keep the ligaments strong, will help keep the nervous system free of interference. It works all together.
So if they insist on playing football, I mean, they can come to you.
This is the best way of keeping them, their performance at their peak. because we're keeping the spine aligned, we're keeping them free of interference, we're keeping their structure strong, and, you know, again, feeding them from the inside out too. If they need supplementation to help their ligaments stay strong, to reduce the risk of injury, then we load them up with certain medications for their, supplements for their, for the structure of their bones, their ligaments. There isn't anything that this treatment won't help. People come in with severe problems with constipation, with heart palpitations, with asthma, with all of these different kind of problems with the systems of their body. What is activating those the systems? It's the nervous system. The nervous system makes your heart beat, makes your lungs breathe, makes your stomach digest. The nervous system is responsible for every single solitary function in your body. Any kind of interference with that will cause dysfunction anywhere in your body, not just pain in your back or pain in your neck, dysfunction in any place of your body. So what we do, what we do is we go and we trace those nerves back to the spine. We know where the nerves come from that regulate the heart. We know where they come from that regulate the lungs. We put life back into that area by just giving a simple adjustment in those areas, freeing up the interference, and lo and behold, everything just starts working properly again.
Well, Monique, I know that you are newly appointed as the relocation real estate individual for our sports stars that are coming into Michigan.
Yes,
really
ma'am.
quick, we've got maybe about 1 minute. Tell me a little bit about that.
Yeah, I'm a full-service real estate company, but that was one of the elevations I was looking for, was to work with the athletes. And a lot of them are getting these $1 million contracts, but they don't know a whole lot about home ownership. They're transferring in. They know their sport. They need to get to practice. So they need to be, you know, displaced. They need to be positioned in a home where it's full-blown concierge service, and that's what we provide for them. It's not just the full-blown concierge service, but, you know, all the other things that helps to make them whole in not only their business life, but also in their personal life. So putting financial advisors around them, the nuts and bolts, we do it from the chef to interior decorating to, you know, helping them with that Mercedes or Bentley, helping their kids to get to school. It's a full-blown concierge service. We do the full package for them, making life easy for them so they can transition into their sport and do what they do best.
I love it. Well, I'm
awesome.
seeing a connection here. Sports, real estate. There you go. I see full service coming into fruition here.
Yes.
Would love that.
Absolutely. Dr. Sheila, thank you once again. I know you were on the show before and you were so informative, and once again, you're amazing.
Thank you again so much for having me.
And I'm coming to see you. So you gotta do something
I
for
have
me,
been
just
ready
what you
for
did.
so long for you.
Okay.
Promise.
Monique, it was a pleasure.
So good to meet you.
I know that you do real estate.
Yes.
And, you know, I want to talk to you about foreclosure and short sales.
Absolutely.
I hope you can come back and we'll
100
talk.
Would love to. Would love
Wonderful.
to. Absolutely.
Wonderful. Thank you so much, ladies.
You're welcome.
Monique, Dr. Sheila, and thank you for joining us on Community Connection, your window to the world around you. We'll see you next time.